Hello and welcome. Today we're diving into a crucial topic that could save lives. How can you tell if someone might have HIV, especially in those early stages when it's most dangerous yet easiest to overlook? HIV can affect anyone, but it's important to understand the signs, especially in men. The sooner it's caught, the sooner treatment can begin, and the better the chance of managing it. Stick with me throughout this video because what you learn here could not only save your life, but also the lives of others around you. First, let's break it down. HIV stands for Human Immunodeficiency Virus. It's a virus that weakens your immune system by attacking the body's T cells, which are responsible for fighting infections. Over time, if left untreated, HIV can lead to AIDS, acquired immunodeficiency syndrome, which is a much more severe stage of the virus. But here's the thing, many people, especially men, can carry HIV for months, even years, without knowing it. That's why recognizing the early signs is critical. And even though many of these signs can resemble common illnesses, it's the combination of symptoms and their persistence that should raise red flags. So how is HIV transmitted? The virus is spread through contact with certain bodily fluids: blood, semen, vaginal fluids, rectal fluids, and breast milk. The most common ways people get HIV are through unprotected sex, sharing needles, or contact with infected blood. But unlike many viruses, HIV doesn't spread through everyday contact like shaking hands, sharing utensils, or even kissing. That's because HIV can't survive long outside the human body. Now let's talk about the timing. After someone is exposed to HIV, they typically go through an acute infection stage, also known as seroconversion. This usually happens within 2 to 4 weeks after exposure, and during this period, the virus replicates quickly. This stage is often accompanied by flu-like symptoms, which can be so mild that many people don't even realize they're infected. And here's the scary part. During this stage, people are highly infectious and can easily spread the virus to others without knowing they have it. The most common first sign of HIV is surprisingly something most of us have experienced: flu-like symptoms. This includes fever, sore throat, and swollen glands. You might feel like you're coming down with a bad cold or a case of the flu, but this is actually your body's immune response to the virus. Your system is trying to fight back, but since HIV attacks the immune system itself, it's not always successful. If you've recently been sexually active and experience a prolonged flu that won't go away after a couple of weeks, it's worth considering that something more serious might be going on. Fever is one of the earliest and most common symptoms of HIV. It can range from mild to severe and is usually accompanied by fatigue, swollen lymph nodes, and a sore throat. This happens because the virus is entering the bloodstream and starting to multiply. Your immune system, in response, creates inflammation as it tries to fend off the attack. Fever might seem like no big deal. It's a symptom we all experience from time to time, but when it lasts longer than usual and is paired with other warning signs, it's important to pay attention. Swollen lymph nodes, particularly in the neck, armpits, and groin, are another early indicator. Lymph nodes are small bean-shaped glands that play a crucial role in your immune system, helping to filter harmful substances and fight infections. When your body is dealing with HIV, these nodes become swollen and tender. If you notice persistent swelling in these areas, it's a sign that your immune system is under stress and could be fighting something serious. Another key symptom that people often overlook is persistent fatigue. We all get tired sometimes, especially with the busy lives we lead, but this type of fatigue is different. It's not the kind of tiredness you can shake off with a good night's sleep or a restful weekend. This is a deep, lingering exhaustion that makes even simple tasks feel overwhelming. If you're finding it hard to get out of bed or feeling winded after doing things that never used to tire you out, like walking up the stairs, It might be your body telling you that something's wrong. This isn't just the result of a long work week. It could be your immune system struggling to fight off the virus. Moving on to another telltale sign, joint and muscle pain. This is often more common in older individuals, so if a younger, otherwise healthy man starts experiencing these aches, it could be a sign of something more than just a strained muscle. The inflammation caused by the immune system's fight against the virus can lead to widespread discomfort, particularly in the joints. These pains might seem random or unexpected, especially if there's no obvious cause like injury or overexertion. Pay attention to persistent joint pain that doesn't seem to have an easy explanation. Skin problems are another early indicator of HIV. Rashes can appear as red, itchy patches or small pink bumps that resemble pimples but are far more widespread. These rashes are common during the early stages of HIV infection, also known as the seroconversion period. While skin conditions can be caused by many things, rashes that seem to come out of nowhere, especially when paired with other symptoms like fever or fatigue, should not be ignored. The skin is often a reflection of what's happening inside your body, and when your immune system is compromised, skin issues are one of the first signs. Next up is the dreaded dry cough. Now, we've all had a cough before. It's usually no big deal, but this particular cough doesn't go away. You can try antibiotics, inhalers, or home remedies, but nothing seems to work. It sticks around for weeks or even months and becomes increasingly frustrating. If you or someone you know is dealing with a chronic dry cough, especially if it's accompanied by any other symptoms like fatigue or fever, it's time to take action. HIV can cause long-lasting respiratory problems, and a persistent cough is often one of the first signs that something's wrong. Digestive issues like diarrhea, nausea, and vomiting can also point to early HIV infection. Now, we've all had stomach troubles from time to time, but if you're experiencing these issues regularly, without an obvious cause like food poisoning or a stomach virus, it could be a sign of something more. Diarrhea that lasts more than a couple of days, especially if it doesn't respond to over-the-counter treatments, is a red flag. Staying hydrated is crucial during this time because the body is losing fluids quickly, which can lead to further complications if not managed properly. One of the more surprising symptoms of early HIV is night sweats. Imagine waking up drenched in sweat, even though the room is cool or you're not wearing heavy pajamas. This isn't your average "I had a bad dream" sweat. It's intense and happens regularly. Night sweats are your body's way of responding to the virus, and they can occur even when there's no apparent reason. If you find yourself waking up in the middle of the night, soaked through your sheets, and this becomes a pattern, it's something to be taken seriously. Now, here's a key point to remember. Not everyone with HIV will experience all of these symptoms. Some people might only have one or two, while others might show no signs at all for years. That's why getting tested regularly is so important, especially if you're in a high-risk group. Testing is quick, confidential, and can provide peace of mind. Early detection of HIV can make all the difference in treatment and quality of life. Modern medications, when taken consistently, can manage the virus and prevent it from progressing to AIDS. But the most important thing is prevention. Avoid unprotected sex with casual partners, use condoms correctly every time, and don't share needles if you use intravenous drugs. Educating yourself and others about safe practices can stop the virus from spreading further. If you think you've been exposed to HIV, don't wait for symptoms to show up. Get tested as soon as possible. The earlier you catch it, the better the outcome. In conclusion, HIV is a serious condition, but with today's medical advancements, people with HIV can live long, healthy lives. The key is early detection and prevention. Pay attention to your body, recognize the signs, and don't hesitate to seek help if something feels off. By being proactive, you're taking the first step toward protecting your health and the health of those around you. Thank you for watching, and remember, knowledge is power. Share this video with others so that we can spread awareness and help prevent the spread of HIV. Stay safe, stay informed, and take care of each other. Quick disclaimer: the information provided in this video by Tip Top Health is for educational purposes only and should not be considered medical advice. Always consult with a healthcare professional for accurate diagnosis and treatment options.